Hello, everyone. My name is Kyle Sebastian, and I am the Higher Education Programming Coordinator at the JED Foundation. I want to wish everyone a happy Thursday and welcome you to today's webinar on the importance of tracking student mental health data, especially during our current pandemic. At this point, COVID-19 has been a reality in the United States for anywhere from 7 to 9 months, depending on where you are, and has changed everything about our work on college and university campuses. And so with that in mind, we hope that today's webinar will provide meaningful opportunities to respond to our current challenges. And first off, we want to thank you for the time you've taken to join us today during this truly unprecedented time. For those of you who are unfamiliar with the JED Foundation, JED is a nonprofit that protects emotional health and prevents suicide for our nation's teens and young adults. And through JED Campus, our signature program for institutions of higher education, we partner with over 330 colleges and universities across the United States, which serve nearly 4 million students, and we guide schools in a 4-year collaborative process of comprehensive systems, program, and policy development to build upon existing student mental health, substance use, and suicide prevention efforts on campus. We are also pleased to newly offer an 18-month program called JED Campus Fundamentals, and details for all of this will be found on our website linked at the end of this presentation. And today we are also joined by the Healthy Minds Network, which is an interdisciplinary team of scholars based at the University of Michigan, Boston University, and the University of California, Los Angeles, dedicated to improving mental and emotional well-being of young people through innovative, multidisciplinary research and scholarship. In a moment, I'm going to formally introduce our two panelists, take us through some logistics for GoToWebinar, and share our learning objectives for today's presentation. Our presentation will be followed by roughly a 10-minute Q&A, for which I invite you to participate by typing questions throughout today's presentation. First, I'm joined by Peter Siglarek, who is a research specialist with the Healthy Minds Network team and is based out of the University of Michigan. As research specialist, Peter helps to strategize how the network's research may be translated into impactful programs, education, and tools for youth across the nation. I'm also joined by my colleague, Christelle Isaka, who is a JED Campus advisor and the data lead with our partnership with the Healthy Minds Network. And Christelle works with JED Campus schools over our 4-year collaborative process. While you have a chance to read our learning objectives, I'm going to go ahead and give some housekeeping items. First, if you need closed captioning services at any point during today's presentation, please click the link that was provided in the chat message as you logged on to GoToWebinar. This will open another window in your browser for you to follow along with a live transcription of today's presentation. Once again, if at any point during the webinar you have a question for our two presenters, please type it into the question box on GoToWebinar, and we will answer it during our Q&A at the end. Finally, today's webinar will be recorded for all those who could not attend this live session, and the video recording, slides, and transcript from the closed captioner will be sent to all registrants by the middle of next week via email. And as always, a recording of this webinar will be accessible via JED's online mental health resource center. Okay, and so with all of that out of the way, I'm going to go and pass things off to Peter to kick off the rest of our webinar today. And I want to once again thank Peter, Christelle, and all of you for joining us today.
Yeah, thank you so much, Kyle. So as Kyle mentioned, I'm Peter Siglarek, research specialist with the Healthy Minds team. Very excited to be here today, as I am always, to work with our partners at the JED Foundation. I do want to give a quick heads up that you may hear a young child screaming occasionally in the background as he gets ready to go outside. So if we want to advance the next slide, what I'm going to do first, before getting into some of our recent data on the mental health of students among the COVID pandemic that we've collected, I want to give a brief overview of the Healthy Minds study for those not familiar. I am going to go through this portion fairly quickly, given that I think most people here are familiar with us in some sense. So please ask questions, and I'm happy to answer during the Q&A. Bit about the Healthy Minds study. It began back in 2007, and since then we have collected over 400,000 respondents of college students at the university level, community college, but also graduate school and professional schools. And we have over 350 different campuses that have participated to date, with many of those being campuses that come back and participate on an ongoing basis. We've really, in the past 6 years, we've made a big effort to increase our inclusivity, especially focusing on bringing in a lot of community colleges and technical schools into the study. And right now we are expanding that effort of inclusivity to make sure that we are doing a better job at bringing on partners at HBCUs, HSIs, and tribal colleges and schools as well. So the Healthy Mind Study is a comprehensive public mental health assessment tool. So it not only assesses your typical mental health clinical outcomes of depression, anxiety, self-injury, suicidality, eating, body image disorder symptoms, and related disorders, but we also ask a number of questions related to different health behaviors, social behaviors, environmental factors, and even things such as perceptions of climate on campus, and other topics which I will go over soon. So if we want to advance the slide. So the Healthy Mind Study is a study conducted in a modular format. Since everyone here can appreciate that mental health is very complex, there are many different topics. Quite literally everything we experience relates to our mental health in some way. We've broken up our survey into different topics that can be chosen based on a school's needs, or as we do with the JED Campus program, based on the program's objectives. However, every school is assessed 3 core topics, or what we call our standard modules. These are demographics, the basics that we use to contextualize the data, mental health status. So this is where we are asking about those more typically thought of clinical outcomes, but also ask about aspects of positive mental health and other directly related health behaviors. And then a module on mental health service utilization and help seeking. This doesn't just focus on traditional service utilization, such as counseling centers, therapists, but we are also asking about informal help seeking and other social protective factors here as well. For our elective modules, we have so many, we got to break it up into 2 slides. So rather than read everyone to you, I will just again reiterate the point here is there is a lot related to mental health. We recognize that for a lot of schools, whether they have participated in Healthy Minds in the past or they are just coming on, very often using the Healthy Mind Study isn't the first time you are looking at your students' well-being or mental health. So there are things you already know, there are things you want to know, there are things that you want to dive deeper into. This is why we have this modular approach, where the school can, based on their needs, their understanding of their students and their campus community, tell us which areas of mental health are they most interested in, at least for that time being, and we can tailor the survey accordingly. For the JED Campus program, we have some of those modules already predetermined to go along with the strategic plan that JED Campus implements. Those modules are knowledge and attitudes about mental health and mental health services, upstander bystander behaviors, mental health climate. Next slide, please. The climate for diversity and inclusion in most cases, resilience and coping. Christelle, were there any that I missed? Just to double check.
Our new JED Campus schools that are doing Healthy Mind Study are also doing the COVID-19 module.
Yeah, great, perfect segue, thank you. So you probably noticed that there's asterisks next to those last 2 topics there, student athletes and COVID-19. These are 2 special studies that we have going on right now. The student and athlete study is we screen out or filter out the student athletes who are in the participant sample at the beginning, and we give them a special set of questions. It's replacing some questions asked of some students, and in other cases, it's additional questions but just a few, only what's necessary, not to create too much burden on our student athletes. But this is really aimed at getting at some of the issues that are very unique to being a student athlete on college campuses, as I'm sure we can all imagine, with the unique demands they have on their schedule, but also the differences in how they experience interactions with faculty, staff, their perceptions of the climate. These are things that we are trying to get at through that module. And to date, we've had over a dozen schools participate, and we're starting to look at that data now. The other one, obviously, is a special module now for COVID-19, which we will talk more of later. So after a school participates in the survey, we provide back some deliverables for that school. So probably the most popular thing that we deliver back to the school is our data report. We are currently working now on thinking of ways how we can build that out in terms of customization for schools, but essentially what you're getting here is an executive summary report with nice, pretty graphs and very easy to interpret explanations as to what are the various proportions of students experiencing different mental health outcomes, engaging in certain behaviors, how many of students positively endorse the campus climate versus negatively endorse the campus climate. And we find that this report is very, very helpful for schools, especially when they need to communicate to maybe higher level administrators or the general population, for providing those broadest, that broad stroke overview as to how your students are doing. Moving on to some of the more in-depth deliverables we provide, another popular tool we have is our online interactive data interface. This is where we have this available to the public at the national level, so anyone can go to our website, healthymindsnetwork.org, and find this on the website and look at our national data all the way back to 2007. This tool shows a lot of the same data points that the report does, but the main difference here is if you are an individual school, you have a unique login where you can go in and you can break that data up by which years you've participated in the Healthy Minds study. So we keep a record of that, so you have access to every year that you participated. Breakdowns on a number of different demographics. We have year in school, department or school, citizenship status, degree seeking, field of study, gender identity, race or ethnicity, residence, nope, that's it. Years in school, I was going to repeat. So we have a number of variables that you can break down from a demographic standpoint, but then we also have the ability to compare your school's data on any outcome to both the national sample of that same roughly calendar year, as well as some identified peer institutions. Based on institutional characteristics of your school, we have an algorithm that determines which other schools that participated are most like you, and then you can see how your results match up to theirs. So finally, for our deliverables, we also provide the economic case memo. So this is a very unique and special thing developed by our director and investigator, Daniel Eisenberg, in which the short and skinny is based on your results as to how many students are experiencing negative mental health outcomes. We can make a fairly accurate estimate as to how many of those students or how many dropouts a school may experience are due to students experiencing mental health problems. Therefore, based on how much tuition your school is generating, tuition revenue your school is generating per student, we can make the calculation to determine, based on X amount of dollars invested in mental health programming, how many dollars would your school save, or better put, how many more dollars would your school make compared to right now in tuition revenue based on students retained. So of course, I would argue probably all of us here are in for helping students for the moral sake of it, right? We're here because we truly care. We know though that there's limited resources and every school within a school, there's competition for those limited resources. We've had a lot of positive feedback, especially from medium-sized and smaller institutions, where when they were able to bring this economic case to their administrators, they were finally able to really make traction on some arguments for securing funding for different programmatic efforts or expanded counseling center staff or whatever else they may have been seeking. So that is a long, short overview of the Healthy Minds study. And the one last thing I will add on the deliverables is those are kind of our three main deliverables. We're also providing data back to JED that is unique for them that they can work with you on. We have ongoing reports, data set that we share, as well as we're just always available for statistical consultation for our schools that participate in our study. So let's talk about what the Healthy Minds study has found during this very, very unique year. So we, as discussed before, we developed a COVID-19 module with the American College Health Association to look at what is unique about the pandemic and its impacts on students, hypothesizing that it would have a detrimental impact on the mental well-being of a lot of students. But of course, why not put data to that to see if that hypothesis is right, but also more importantly, what specifically is going on with them. So before sharing the findings from that, first it's helpful to know what were things looking like pre-pandemic, at least in the US. So on the next slide, we have our findings. We have our findings dating all the way back from whenever we added in an outcome during the study. So you see we've always been assessing depression, but then started assessing anxiety in its current form in 2013 and flourishing in its current form in 2012. So this is data from those inception points all the way up through the fall 2019 semester and a little into January 2020 as well. So before the pandemic reached the United States in a widespread form, we were already seeing a rise in the negatives and a decrease in the positives, unfortunately. Something to note about these rates is that we saw in between the years 2016 and 2017 a very significant spike. So from 2007 and 2013 up until 2016, we're seeing a steady rise in the proportion of students who were screening positive for depression, positive for anxiety, and a steady decrease in flourishing as well. And from 2016 to 2017, we saw depression spike from 25% of students screened positive to a little over 30% of students screening positive. So 5% at the population level, remembering this is a sample representative of all students on campus, very significant increase. And then there was another jump from 2017 to 2018 from 30% to 37%. So in that 2016 to 2018 period, big increase. Likewise for anxiety, we saw the spike from 21% to 26% screening positive for anxiety, 2016 to 2017. And then from 17 to 18, that further spiked from 26% to just over 31%. So major increases there. Flourishing had a similar significant drop, but interestingly enough, seemed to happen a year earlier. So from 2015 to 2016, we saw flourishing take its most significant dip with 53% of students reporting that they were or screening that they were flourishing in terms of their mental health, all the way down to 45% in 2016. So very significant drop there. We know that the 2016 to 2017 year was a very tumultuous year for the election, for major shifts in political culture and societal culture around the United States. And we actually recently, a couple days ago, had a paper published by several of our team members that specifically looked at how that election cycle most likely had a negative impact on the mental health of Muslim American students. We suspect that there was a broader impact more generally, at this stage, though, these are still hypotheses, and we are always seeking feedback from our campuses as to what they notice when on their local levels too during those years. So come January, we took a breath with the American College Health Association. We said, we know things are going to change even further here, or we imagine they will. Let me be a good researcher and stop using directional language. So we imagined that we were going to see a major difference. So we worked with the American College Health Association to develop a set of items to launch throughout the spring during the pandemic with schools that were still able to participate. We are fortunate enough to have 14 schools between the months of March and May of 2020 participate in the study, and it really ended up being a very diverse sample, not only institutionally, but also at the individual level for demographics, compared to what is usually collected in our field. So we're very grateful for that and all the schools that participated. We had a number of questions ranging the experience, asking students, of course, about their mental health outcomes, as we always do. So all students still got those 3 standard modules. We also asked them about their perceptions of the prevalence of COVID-19, their own susceptibility of one loved ones and people they cared about, generally asking about what are their concerns related to the pandemic, impacts that they believe the pandemic had on their daily living. We did ask about their hygienic behaviors, their social distancing, what they were doing, what were their trusted sources of information for the pandemic, as well as how supportive they saw different elements on their campus during the pandemic. So let's dive into those results. So on this next slide, we have a summary slide of some of the, again, the broad strokes findings we had here. I do want to reflect really quickly, this data that you're seeing right now is specific to the schools that were, that the Healthy Minds team assessed. The patterns we found with ACHA were nearly identical, but some of the outcome measures they use are a little different. So again, in the vein of being good researchers, we want to present them separately. But we do present both sets of results in our report that we can share at the end. Some of the major findings we saw were that depression, there was a significant increase in students screening positive for depression. You can see in fall 2019 as compared to that March to May period. We simultaneously saw a significant drop in students screening that they were flourishing, and a very significant drop in the number of students that were screening for screening positive for illicit for substance use and abuse, as well as being categorized as binge drinking behaviors. So some interesting findings there. Another very significant finding we found was a sharp uptick in the number of students saying that they felt that their mental health had a direct impact on their academic performance, and that their academic performance was the worst because of it. Something interesting here to compare, I'm sure a lot of people noticed the suicidal ideation dropping from 20 to roughly 20 to 17%. In the ACHA survey, they use a different metric for suicide risk, and they saw a little increase of about 2 percentage points. So something that we're still trying to work to tease out there. We saw a dip, they saw an increase. Similarly, they have a similar flourishing metric that we do that also saw a dip since the onset of the pandemic, but then they have a very specific metric that gets at resilience, so a specific component of flourishing, that they actually saw a 2.5% increase in the number of students who were reporting that they were feeling more resilient. So we see here that there are increases in the negative outcomes, particularly depression, as we think relates very directly to people's perceptions of loneliness and isolation during this time, and feeling that mental health is getting harder to manage during their studies. But we're also surprisingly seeing, these drops in some of these what are typically thought of risky behaviors in terms of substance use and drinking. And we're seeing maybe some indicators that people are feeling a little more resilient. And we can talk about potential explanations for that in a bit. Unfortunately, though, as we're seeing that a lot of what we're seeing is in the negative camp, we also saw that 60% of students indicated that since the onset of the pandemic, they've had a more difficult time accessing care for their mental health needs. So while students are experiencing worse outcomes, they also feel like they have less access to care. So this is a very, very critical time for our students. Looking at some of the related factors, next slide. Some of these other topics that I mentioned earlier. So for example, we asked about students' perceptions of susceptibility versus risk. To note, we saw a lot of we saw that most students did have some level of concern about their safety, and specifically about contracting the coronavirus or developing COVID-19. Kind of going counter the narrative that that I think was portrayed in the media a lot of, college students not really caring, young people being oblivious to the issue. From what we saw, that it seems that a lot of people of this age group are indeed worried. Likewise, we also saw our results showed that majority of them at least report that they are very actively engaging in social distancing and all the CDC recommended behaviors. The number one most trusted source of information reported by students are public health agencies. So they're going to the right place for their information too. And that one of the greatest concerns in general reported was actually the safety of their loved ones and other people they cared about. So very counter this narrative we're getting of the young people don't care, the young people are going out and partying. While there may be some truth to that, and we can definitely talk about how students' behaviors have changed this fall. But again, what's the perception and what's the narrative versus what does the data actually tell us? The data we have so far tells us students by and far are concerned, they care, they're looking out for others. Looking at other impacts the pandemic has had, next slide. For most students, they've reported experiencing more financial distress since the onset of the pandemic, and we have, over a decade's worth of data from our study, as well as many other studies, have found that financial stress is a strong predictor of mental health outcomes. So we suspect this is contributing to some of those negative outcomes we are seeing. Something else to note here too is housing security. So a third of students surveyed reported that their living situation changed directly due to the pandemic. Now, of course, there are a lot of different ways it can change, but the main takeaway is their sense of their sense of home stability was rocked and shifted by this pandemic. And then finally, another point I want to highlight here is discrimination. So we asked students directly as it related to the pandemic, whether or not feel like they've experienced discrimination based on their race or ethnicity, and whether or not they've witnessed discriminatory acts or hostile behavior to what they perceived was due to an issue around someone's race or ethnicity. So I'm actually going to focus on figure 7B first. Over 40% of students reporting that yes, they do think they witnessed something. When we asked them what they believed the victim's race or ethnicity was, 93% of those students who witnessed reported that they believed the victim was Asian or Pacific Islander. So similarly with figure 7A, we see that roughly 6% of students are saying, yes, I've experienced discrimination. Of that 6%, 73% of them identified as Asian, Asian American, or Pacific Islander student. So this, unfortunately, for those of us who work in public health, is not surprising. We know the United States, to be frank, has a disgusting history of anti-Asian racism, particularly when it comes to the spread of communicable diseases. And we are seeing a resurgence of that right now during the COVID-19 pandemic. And we know this has a direct impact on the mental health of Asian, Asian American, and Pacific Islander identifying students. So again, as we're thinking about the groups that are vulnerable, what's making them vulnerable, this increase in discrimination that unfortunately is being heightened by our own government is something that we definitely need to take into consideration, make sure campuses are doing their work to protect our students. So, all this said, the message here is that it is very important to pay attention to the mental health of your students. And I know a lot of us are thinking, but with everything else going on, why am I focusing on this now? You know, I have so much. I get that students are struggling, but can't we just like assume everyone's struggling, we need to do more? Hopefully, as I just illustrated, what's really important about it is knowing specifically why students are struggling and what's going on. So I kind of have like 4 plugs here. The first one is it's important to have knowledge, and that is specific knowledge. So we want to make sure that we are being informed as to how the students are doing, so we know exactly where to target our efforts and not honestly waste our time and precious resources during this pandemic trying to solve problems in ways that doesn't help. Bringing awareness to the issue too. It's one thing for us to witness things in the news that may or may not be accurate. As I pointed out here, there has been some increased news coverage focusing on anti-Asian racism that has been correct in identifying that's a problem. But then as we also pointed out, there's a narrative going around in the news of students not caring that maybe is not so accurate. So we want to bring awareness to both the things that people do know about to further highlight the need to address these issues, but also the things that people may not know about. It's important for the campus's image, and I would argue more importantly, as I'm sure most people here feel, for your campus culture. So cultivating a positive campus culture where students believe they are supported, that they and people like them are valued. We know from our data that this is one of the stronger predictors of a student's mental health. And finally, preparation. So I have a few quotes here that are talking about some professionals' hypotheses as to how the COVID pandemic is not only making things more difficult right now, as our survey is showing, but really getting to that this is most likely going to have long-lasting impacts. This is a societal trauma. So like with experiencing any trauma, there's the likelihood of having lifelong repercussions. And we need to all be vigilant and looking out for ourselves and others, but also accurate in that vigilance. Make sure that we are doing things that help and don't further harm. There's a lot being changed in the way we communicate with each other electronically. That can be good for maybe increasing some people's access to their communities, especially if you identify with a community that is often isolated or marginalized, such as a lot of LGBTQ students. However, we also know there's so much positive mental health benefit to that face-to-face interaction. So again, we want to make sure that we are being prepared not only for the rest of this pandemic, but for the years to come. So with that, I will turn it back to my colleagues at JED, and I look forward to addressing people's questions at the end.
Great, thanks, Peter. So hi again, everyone. As Kyle mentioned in the beginning, I'm Christelle Isaka. I'm a campus advisor and data lead at the JED Foundation. And I thought it'd be helpful if we could just go through some examples of how some of the colleges and universities currently in our JED Campus program are taking on this data issue. So our first, if we can go to the next slide, our first example is actually from pre-COVID. This was a poster campaign that some of our folks at Boston University did, on the left side using Healthy Mind Study data, on the right side using National College Health Assessment data. Just examples of how you can use whatever information you already have about students, whether it's COVID or not, to encourage some of that help-seeking behavior, to increase access, as Peter mentioned earlier, and use it in kind of effective communication ways. In addition to things like the COVID module that Peter talked about that both Healthy Minds and ACHA are doing, we know there are other ways that schools can use data to get a sense of what student trends look like. And so one example of this, if you can go to the next slide, is here's just like a basic table that we pulled up from a school that was doing the Healthy Minds study before COVID and then during COVID. And we were just tracking for them, how did that change certain metrics that their team was interested in or that our team was interested in. And these weren't specifically questions from the COVID module that Peter went through, but they're still important for us to be thinking about in terms of how is student mental health being impacted, right? So that first one, Peter already mentioned, how have emotional and mental difficulties impacted your academic performance? We can look at depression, we can look at anxiety. That mental health therapy and counseling metric was interesting, and we talked about this with that school as well. It actually increased, which, given what we know about students accessing mental health services in general during COVID and the challenges that they might face, is actually really positive for the school. And so if you are a school that, whether you're doing the Healthy Mind Study COVID module, or you're doing the ACHA, NCHA COVID module, or doing your own questions or surveys, really be thinking about how are you comparing that information to what maybe you were already tracking. If you're a school, especially that does the Healthy Mind Study or National College Health Assessment on a regular basis, think about what national comparisons exist as well, right? So it doesn't show up in this table, but we also took these metrics for the school and looked at how does this compare to changes pre-COVID versus during COVID nationally, right? And so, as Peter mentioned, while access to therapy and counseling increased for this school, it may have decreased for a lot of students nationally. And so schools with that comparison actually get a better sense in a lot of ways of how are their students being impacted compared to what the overall trend might be nationally. That said, we also know there are many ways that schools might be collecting or using data in ways that aren't necessarily NCHA or the Healthy Mind Study. And so I thought it'd be helpful if we added a few examples too of some of the ways that schools are currently collecting information or data from their students, from their campus communities, and how you all might be able to add some of these information seeking methods into what you may currently be doing. So a number of our schools have been sending out surveys to faculty and staff specifically in order to identify what types of support resources do faculty and staff need, what type of resources do they need to better support students, how can schools better address some of the access issues that we're talking about, and what might be unique to their COVID situation or their student population. For example, some of the housing insecurity, food insecurity, other life issues that Peter had mentioned students we know are experiencing even more so now during the COVID pandemic is something that our schools are dealing with as well. And so thinking about, are there additional support resources that faculty and staff can have to support students who might have those needs is something that's really helpful. Another helpful piece related to access is partnering with students and student groups and student leaders to help identify some of these need areas or some of these trends. So for example, we've had schools that have partnered with student government to put out student surveys. They've partnered with their Active Minds chapters or peer educators or peer ambassadors on campus. A lot of times those student groups might have more frequent or ongoing touch points with students, especially around social media or maybe even over email. And so a lot of times response rates might be higher if schools are partnering with some of those student groups to do that. Adding mental health questions to any COVID-related surveys going out to students. So a lot of schools we know are currently sending out more health-specific surveys to get a sense of where students are. So making sure that mental health, substance use, general well-being questions are also being included in that is really helpful. A number of our schools have also incorporated a sort of quick mental health check-in question to their COVID daily check-in. So if your school does have as part of your COVID response plan that students are doing daily check-ins online or through an app or some sort of thing, adding a mental health question about how are you doing today, or where's your, rank your mental health from 1 to 10, even if it's a really basic question, getting sort of a benchmark of where are students at in terms of mental health and well-being and how might that be changing over the course of this fall can be a really helpful tool for you all. Survey questions incorporate into social media. So Twitter polls, Instagram examples. There's one on the next slide that I'll get to in a second. But figure out ways to be interactive in how you're collecting data. It's not just, here's a SurveyMonkey link, do a 20-question survey, but it might just be one question here or there. And a lot of times those things can be really helpful if, for example, all of your classes are online and you're using an online platform for learning. Is there a way to do a pop-up survey question? There are a lot of kind of creative ways to be able to build this into whatever systems your school may already be using. And then finally, looking at data that's already being collected regularly. So that might be, your counseling or health center data trends. That might be, as we mentioned, Healthy Mind Study or ACHA information. That might be any other institutional surveys that you all are already doing on a regular basis. We're not necessarily saying, hey, now that it's a global pandemic, go and do 50 more things. But a lot of these things are small steps or might already be happening. It's about figuring out where does that information live and how can it be looked at in a way that's really helpful for your programming or your policy or the direction that your institution is going in supporting student mental health and well-being. And then there's one more slide. So just a few examples of social media content that came up from a few of our campuses. The one on the far left is UConn. Don't try and join their focus groups. That was back in April, but did some listening sessions on mental health to hear from different parts of their campus community about what were their needs, what resources were needed, and how can they continue to support their students. And then they also had a survey link there as well. So UConn had sent that out on Instagram as a way to recruit students for some of those groups. The middle one is from Creighton. So Coco, their counseling center therapy dog. This is an example of an Instagram survey. So this showed up on their Instagram story. It was just, asking how stressed have you been feeling lately? And students just quickly move their finger on the bar to say, where are you on a scale? And then the counseling center at Creighton can then go in and say, okay, what's the average response of our students? How stressed are they feeling? And if we're doing this on a regular basis, we can be seeing how that's changing over time. And then the third example is just an example of how a school might market surveys that are already going out to students. We know that students are especially inundated with a lot of email now that they might be more remote or getting a lot more communication from their institution. And so Westchester Community College had also put out some marketing on Instagram and social media to encourage students to look out for and then participate in their Healthy Mind Study when it did go out this spring. Next slide. And then I'll pass it back to Peter.
Okay, great. Well, before we pass it off to Peter, I want to say thank you to the both of you for this presentation. And Christelle, I especially want to point out that idea about thinking of all the work that is already being piled up as faculty, staff, and administrator. What are those small steps, those really important touch points for us to understand what is going on with our students now and how we can see that tracked over time? I think that's really important. So you don't necessarily, need to do, a Healthy Minds or an ACHA or one of these other, formed assessments, but you can do, I really love that Instagram idea. I would take that as a student, very easily. So before we get into our Q&A, I do want to remind you all that you can type in your questions. I'm sure there are a number of things that you want some more clarification on, so please type those in now. And now I'm going to pass it off to Peter to share another exciting opportunity coming up later in October.
Yeah, thank you both so much. And again, want to echo everything that Christelle brought up, and something to add on that too. For schools interested in participating in the Healthy Minds study, but thinking maybe now is not the best time. We understand there's lots of resource limitations, fiscally, temporally, just in terms of capacity. We're learning too, so we are being very open and welcoming people in to think about, let's really figure out what's best for your school, tailor something to your needs. And maybe that is just we're providing you with some advice, guidance, or consultation as to do exactly what was brought up. Find what other data streams do you already have going on your campus, or even just what are a few questions we ask that we can that you can use in any of these other formats that make more sense for you. Because the ultimate goal here for all of us is to better student mental health. And on that note of bettering student mental health, Thursday, October 22nd, we are hosting our next now semi-annual symposium. For those familiar with the group, with the Healthy Minds Network, we typically hosted an annual mental health research symposium. Very diverse, very interdisciplinary group of folks that come together and really just chat, brainstorm, digest information, and come up with solutions around what is the state of student mental health, and where do we want it to be? How do we get there? So it's a really exciting time. Since this pandemic period has brought us into the era of doing things online, we've thought, hey, why not do a couple a year, and do them online. So we have one coming up in October. Very excited for this for two reasons. One is we're going to have a focus specifically on advancing mental health equity. As we've seen in the results, we're seeing some health disparities being exaggerated during this time. So always important. Now more than ever, we really need to think about, though, how do we address these disparities, these inequities we're seeing in mental health. But we are also expanding our focus to the K through 12 sphere as well. As some of you may know, the Healthy Minds study, we're making a mirrored study for the high school population as well as middle school. We're working with the JED Foundation's high school programming arm to do our work in tandem with theirs as well. And we have some other partners being there that do work in both the K through 12 sphere and the post-secondary sphere, specifically folks from EverFi and Steve Fund. We'll have some major presentations. So we're really opening up the doors this time, and we're excited to have teachers, administrators, and even some students from the K through 12 population as well as the post-secondary population. So participation is completely free. Again, we encourage, no matter what your background is, as long as you are concerned about young people's mental health, this is the place for you. So please come. The more voices we have at the table, the more productive and beautiful of an event this ends up being. So you can see the link there. You can also go to our website, healthymindsnetwork.org, where we also have a link to register there as well.
There we go. I'm unmuted now. The classic problems. So now we are going to come to our time of Q&A, and thank you for participating with us thus far. Right now we have 3 questions. If a couple more pop in, please feel free to do that, and we're going to try to get through as many as we can in this time. I'm actually going to start with perhaps a pre-COVID, maybe will apply to the new normal, whatever that happens to be in some time in the distant future. I want to talk about definitions and what that means for a lot of these questions that are being asked. And so I know this is a question for a lot of schools. With the questions as the way that they're formulated, to what extent are you guiding students to like give them instructions how to answer a question, on like what does this mean to you, and in terms of keeping that kind of standard, like, you know, what does it mean to feel sad or depressed, or you know, there are other more technical terms that come up like resilience and flourishing that might have different things and might mean different things to different students. So yeah, how does that work?
Christelle, do you have something, or I can jump in first if you want?
You can go first.
Okay, great. Yeah, that's a phenomenal question, and one for social scientist nerds like myself is an exciting one that we're always asking. So one, I guess for starters, one thing is the terms that we're using to talk about these right now, we're not straight up asking students, how depressed are you? 1 to 10. You know, how resilient are you? 1 to 10. These are scores that are developed from a composite of items. And then with the Healthy Mind study, we really strive to use metrics that first and foremost have been validated with this population and have years of evidence behind them. So the screeners we're using for depression and anxiety are the two most popular screeners in mental health, the PHQ-9 for depression, or the Patient Health Questionnaire 9, and the Generalized Anxiety Disorder Screener 7, the GAD-7. So those two are used in doctor's offices when you go for your annual checkup. Thanks to the Affordable Care Act, you should be asked the PHQ-9 during your annual checkup, and you may even be asked the GAD-7 as well. Those have been tested across many different populations, many different ages, and they hold a lot of validity. Because of the length of time we've been doing this study, we're very fortunate that we have the opportunity to test, retest, and sometimes tweak and then test questions over time to try to understand what's getting closest to the construct. Now, of course, we can't do all this in the vacuum of just us as academic researchers, right? So a lot of what we rely on at the Healthy Minds is feedback from our partners at schools, as well as we get regular feedback from students themselves, who we have an open live communication, both through them just emailing our study team back, and they feel free to do so and take advantage of it, and telling us, you know, what they thought went well, what they thought did not go well, and we do read all of those and take them into consideration. And we've gotten some of our best feedback from students directly saying like, hey, I have this unique circumstance and I really think these items did not address it. Wow, thank you. And now we know to incorporate that. We also have an anonymous feedback form too for students to provide feedback that we can use to evaluate. So there's many different levels, from the very technical in terms of thinking of construct validity to operationalizing items, as you think like ideas to questions, and thinking how do you minimize bias in responding. And one of those ways is trying to not be like, to use loaded terms like depression, anxiety, so on and so forth. But we're also trying to increase our avenues for grassroots feedback as well.
And I'll add on to that too. Peter and his team, as well as the folks at ACHA, have done a really good job in, I think, really refining some of the language of their survey tools to reflect this kind of process that we're talking about. As Peter mentioned, we, condensed down some of our data for this presentation, but a lot of those questions are being asked in ways that I think help us just get an accurate representation of student mental health and well-being, not just sort of leading questions. I know the Healthy Mind Study team has their full survey tool on their website, and so if you're interested in some of the more specific language or seeing where those questions are sourced from, you can certainly check that out. If you are a JED campus, I would recommend you reach out to your campus advisor or myself. We're always happy to help you talk through some of the more specific language questions or where students might get tripped up with more specific terminology. I think one thing to think about as well is that surveys are not sort of the end all be all of understanding your COVID data. And so for us at JED, as we're working with JED campuses, we're not only doing the Healthy Mind study with them, we're using that as a way to follow up and then do focus groups with students on campus. So for example, one of the Healthy Mind study questions is around social connectedness and says, do you see yourself as part of your campus community? If there are a lot of students that say, well, not really, you might go into a focus group and say, well, how do you define community? Is community your social circle? Is it about how you identify with your university? And kind of teasing out what that meaning is for them, a lot of times can be a really insightful process for you all as you're gathering information.
Thank you so much. That was great. So 2 more questions, and I don't want to give away everything that's going to happen at the symposium, but we're gonna go there. So one, with HMS, and certainly with what you know from partnership with ACHA, what have you noticed about racial and ethnic differences in response rate to these surveys? Perhaps maybe, before and certainly for the COVID-19 response.
Muted problems. Yeah, so that's a great thing. So as I mentioned at the beginning of the discussion, we're really focusing our inclusion efforts right now on bringing in minority students, specifically when we look at race and ethnicity, non-white identifying students, and bringing in the campuses that are serving those non-white students and communities in greater proportions. So HBCUs, HSIs, tribal colleges, and related schools. So we notice. So this is interesting. We've noticed that on the whole, the groups that are more likely to respond to the survey than their peers are white students than non-white students, female identifying students than non-female identifying students, and older, specifically, I believe it's graduate students as opposed to undergraduate students. So there are these, and these are response rate differences that have been around since we started our survey, that have been around before, that are consistently seen when assessing this population. So something we've looked more recently into in the years is messaging as to thinking about why students might want to respond. And again, this is something where, in the principles of equity, as you can see, as a white male, I can't understand on an experiential level the values and experiences that might lead, for example, a Black female student to participate or not participate, or to more broadly discuss their mental health with a group that is, quite frankly, we're strangers coming in, and in a sense asking them, hey, tell us about this very sensitive things. We can talk about confidentiality all day long, but with certain communities of color, there is known and well-founded distrust when someone comes in and says, oh, it'll be confidential. Oh, don't worry, we're looking out for you. We mean it on our team, but we understand there is historic and systemic barriers there. So again, without giving everything away for this symposium, we are bringing in more of our experts on our team and other teams, and a more diverse representation within our team, and to look at community-based participatory approaches to engage students again from to engage schools and students again from a more grassroots level. For yes, the research goal of increasing participation among these different groups, but more importantly for increasing their representation in the work. So when decisions are made, as they are based on our research and others, about policy, about funding, that the most vulnerable students are taken into account.
Thanks, Peter. And I will have one more question specifically for you. I'll give you about 30 seconds so we stay on time. Can you tell us a little bit more about current plans or future plans for translating the Healthy Mind study into other languages? Again, perhaps without giving anything away.
Yeah, so definitely this is a conversation that we want to have at the upcoming symposium. We have done work very recently with the JED Foundation and other partners in the US and Mexico and in South America for translating into various dialects of Spanish. The Healthy Minds study actually has been translated into other languages in the past in very kind of case-specific examples. And we are looking at how can we bring that in to be more part of our systematic year-to-year effort moving forward. So if you're interested, attend the symposium and we'll talk more.
Okay, great. So with that, we are out of time. I want to once again thank Christelle and Peter for joining me today. For all of you joining, again, we understand that time feels especially precious right now, and the fact that you sat with us here for an hour to learn about all of this research stuff. We're really thankful that you could be here. Again, the link to find out more about the symposium is on your screen. And should you want to learn more about the JED Campus program, JED Campus fundamentals, about taking the Healthy Mind study, perhaps you're thinking about next steps for spring 2021, if you and your colleagues are able to think out that far in advance, there are a lot of opportunities to engage, and they're doing some really great things about accessibility around being able to administer that with your students. So with all that, have a great rest of your Thursday, and thank you for joining us. Take care.